And somebody posted, I think it was in the Brainmaster group, Santiago, I know, does something called brain spotting. And it fascinated me too, because the paper said that if you have a trauma, that there will be, I think they called it like a resonant part of the visual field. And by focusing there, you might actually address the trauma. So I don't know if Jay or anyone else wants to talk about this connection between kind of vision and the pupils and the EEG and how we might leverage that.
Yeah, there's a new Sabre and Fisher has been talking about this the last year or so. This process called deep brain reorienting. Kind of piloted or shepherded by, or discovered by, I'm not sure how to give him the credit, Dr. Frank Corrigan, who's a psychiatrist in Scotland. And speaking of the visual field, the theory behind this deep brain reorienting, and I'm assuming that it is similar to brain spotting in that regard, in that in early childhood trauma, the visual orientation of the infant to the mom. It's not. I'm not being sexist about this. It is the mother, literally the birthing person who gave birth to that child. And if that orienting of visual systems is inadequately bonded, the child is left with a withdrawal from connection. This is the disrupted attachment theory concept underlying developmental trauma. And they've drilled it down to, Corrigan has drilled it down to a brain stem function of the superior colliculus, which then informs the periaqueductal gray, which then informs the amygdala. So the theory behind this deep brain reorienting and why Sabern is so excited about it is we have no trouble accessing amygdala response, but a little going deeper than that is a little more challenging. How do you get to the brain stem, with a surface electrode? It's a little more challenging, and this deep brain, she feels, is going to be the missing piece for trauma recovery from especially early childhood trauma, based on that attachment theory concept. So I'm assuming it's similar to brain spotting. I've never seen brain spotting done. For that matter, I've never seen the deep brain reorienting done, but it is a somatic, non-language based intervention. This isn't about talking about your trauma. This isn't exposure therapy. This isn't EMDR. It's not a lot of things. But I'm really intrigued by this, and I'm really looking forward to seeing her present at ISNR. And she's got a whole thing going on down in South Africa with Ruth Lanius and Bessel. I think the three of them are going to be, or Sabern, Ruth, and Corrigan. Sorry, not Bessel.
Wow.
So Corrigan, Lanius, and Fisher are all going to be in South Africa doing a presentation on DBR. I'm very interested in this. So anybody who's a licensed psychologist, go check it out, because I think it's a good add-on for trauma clients. But I think it connects to what you were just talking about, Anthony, in terms of visual orientation for the infant to the bonding parent. Josh is nodding. That makes sense to you?
Yeah. Yeah. I'm a therapist. Trauma therapy is what I do, all day. And the few clients that I do see, because I'm mostly admin these days, are going to be severe trauma cases. And so I do brain spotting. I do EMDR. Neurofeedback is a big part of what we do with complex trauma, because you're good luck trying to do, complex PTSD without it, or dissociative PTSD without it. I mean, my goodness, I don't know what they did with before that, but it is a very, very useful tool for getting people through, acute parts of this story. And yeah, I very much relate to it. And I think there's people probably in the audiences that can relate to it as well.